Welcome to today's Q&A, and today we have with us Nevzat from IVF Cyprus Hospital. Welcome.
Thank you, Andrea.
And today we're talking about embryo donation, and it's such an important topic because we talk a lot about egg donation, sperm donation, and so many times couples tell me, I didn't know that I could get an embryo. And I would like to explore this topic a bit further so that more people are aware that this is a possibility. So maybe we can start by talking a bit about in what situations would we recommend that patients get an embryo?
Yeah, thank you for this opportunity, Andrea, because we're also receiving lots of questions about the embryo donation. So basically, with the simple terms, embryo donation is combination of the egg donation and sperm donation program. So basically we use an egg donor and a sperm donor and fertilize the sperm and egg to create the embryo for the couple. We call this embryo donation. So this is combination of when we do the egg donation and the sperm donation. So if the woman is in menopause, or if there's any issue with the the egg quality, if there is any issue with genetic disorder or early menopause, combining with on the men's side, that if there is no good quality of sperm or zero quality, we call it azoosperm. And if we perform the TESA to collect basically the sperm directly with an operation from man, and still there's no any live sperm cells, even on the tissues, or any disease that it might pass with the sperm, we avoid to use the sperm from the man. In that case, we use the sperm donation. And so when the two cases combine together, we have to use egg donor and the sperm donor to create the embryo donation program. We have lots of cases around the world for this. So in that case, for example, some people, they find themselves a bit late, like after 45 years old or around 50 years old. And for men, it's not really issue if they don't have any problem with the sperm quality, but most of the time we are experiencing the sperm quality as well. In that case, we offer embryo donation program for the couples. We send them profiling document for this donor program. Woman gives the entire profile of her, and same for the man. So in that case, we try to find the best suitable egg donor, which is look like for the woman, and same thing for the man, who is look like for the man, to create the best suitable embryo for that particular couple. So when they have the baby, basically baby look like them. That's the most critical part.
That is really good, because I believe I've seen in some areas where they already have leftover embryos from people who didn't use them. But of course, in that situation, you can't choose the characteristics. So here it's completely fresh.
Fresh, yeah, exactly. Yeah. No, that in my opinion, it's not ethically to do that. Yeah, probably around the world they're doing this. No, for us, we send the profiling document. Then we find the best options for the egg donor. We provide the couple. Then we find the best suitable couple of options for the sperm donor. Provide the couple. They choose the best option for themselves. We, of course, recommend them what would be the best. And then we create the embryo. Especially, even like here, we consider the blood type. We really try to find the donor for the blood type which is suitable for the couple. If there's anything happen in the future and they need to, transfer any blood and everything, we really want to, have that much. So we want everything to look natural and avoid any possible problems in the future for the couple. That's why embryo donation program is the most critical program we are offering, because we have to consider different cases. And we really, we really touch all those points to offer the best program for the couples here.
And I imagine if we're choosing a really good egg and a really good sperm probably the chances of success with this treatment are probably higher than normal IVF.
Yeah, actually, this program has the highest success rate compared to normal IVF or IVF with egg donation or IVF with the sperm donation, because to create the embryo, you are using the best quality of eggs and best quality of sperm to create the best quality of embryo. So the success rate is, last 3 years, average 85%, which is the highest rate that we are having. Of course, when we break down to the age, it's different, but average that we applied this program for mainly couples between age 35 and 45, we have a huge success rate. We also apply this program up to 55 years old, because that's the legal maximum age that we can perform the IVF in North Cyprus. It's 55. We have lots of couples or single ladies that we are offering this embryo donation program above 45, above 50 years old. And we also have a good success rate over there. Of course, when you are above 45 years old, the live birth rate starts to go down. But of course, we are aware of this. That's why the treatment process is completely different for an age above 45. But yeah, even over there, our success rate is quite good.
And I think the final question has to do with the legal rights of these donors. They don't have any right, and I imagine it's anonymous as well.
Yes, basically both sperm and egg donation program is anonymous. Therefore, the embryo donation program is completely anonymous. The couple never know who is the donor. Donor never know if we ever use their sperm or eggs, and when we will be using it, or if we use it at all. So, and by law, they have no rights. Nobody can find out who was the donors, or nobody can find out who was the family. So there's no legal right on that. And by law, the family, dad and mother, has the full legal right on the baby.
Thank you, Nevzat.
You're most welcome. Thank you.